Isolated, hot, poor. Assessing the relationship between urban heat islands, vulnerability, and emergency services access in the Twin Cities 7-county metro area. The purpose of this project is to aid Catholic Charities and Ramsey County Department of Public Health to locate vulnerable areas in the Twin Cities metro area that have limited access to emergency services and that are susceptible to the consequences of the urban heat island effects. Effects of the urban heat island. Elevated temperatures from the urban heat islands affect the environment of a community. Increased energy demand for cooling purposes adds pressure to the electricity grid during peak periods. Urban electric demand increases 1.5 to 2% for every 1 degree increase in summertime temperatures. Systems overload by cooling result in controlled brownouts and blackouts to avoid power outages. Increased energy demand causes higher levels of air pollution and greenhouse gas emissions. Elevated air temperatures increase the rate of ground-level ozone formation. Urban heat islands exacerbate the impact of heat waves. Excessive heat exposure contributes to a significant amount of premature deaths in the United States. Urban heat islands degrade water quality via thermal pollution. High temperatures transfer excess heat to stormwater. Heated stormwater drains into storm sewers and raises water temperatures as it is released into streams, rivers, ponds, and lakes. Runoff from urban areas is about 20 to 30 degrees warmer than runoff from rural areas. Above normal water temperatures affect the metabolism and reproduction of aquatic species. This is the Urban Heat Island GIS model. This model adds impervious areas, subtracts biomass, and subtracts lakes to come up with the Urban Heat Island map. This is the Urban Heat Island map, and this map combines the 3 intermediate maps depicting lakes, pavement, and biomass to illustrate the urban heat island in the metropolitan area of the Twin Cities. Areas colored in blue are relatively cool. Areas colored in beige are relatively moderate. Areas colored in red are relatively warm. Now moving on to emergency response times and survival basics. No federal law exists for stipulating response times. Agreements between emergency service systems and political factions ratified to create emergency response time standards. The typical emergency response time standard is 8 minutes or less. Actual emergency response times are between 12 and 15 minutes. The importance of accessibility. Emergency service systems are geographically based. Living near hospitals and fire departments ensures prompt service. Distance to hospitals and fire departments significantly influences the risk of mortality. As distance from emergency service systems increases or access to an area is restricted, response times worsen. Fast response times are a crucial component of the emergency service system. This is the Access GIS model. So, in this model, hospitals and fire departments are merged to create a layer of emergency services, and then the cost distance tool is used to determine the friction distance to emergency services. This is the access to fire departments and hospitals map, so the cost distance. This map illustrates the cost distance to emergency services and the location of hospitals, which are designated by white dots on the map, and fire departments, which are designated as black dots on the map in the Twin Cities metro area. The cost distance tool calculates the least accumulative cost distance for each cell to the nearest source over a cost service. So areas colored in yellow have the least costly distance to emergency services. Areas colored in orange have a more costly distance to emergency services. And areas colored in pink and blue have the most costly distances to emergency services. Now we define vulnerability. Vulnerability is commonly defined as the ability of an individual or group to predict, control, and recover from the impact of natural and man-made disasters. Poverty, seclusion, exposure, and insecurity are common terms associated with vulnerability. Exposure to risk also depends on gender, ethnicity, and age. Defining vulnerability is essential to developing hazard mitigation strategies. Determining vulnerability. Measuring vulnerability is rather complicated because various factors can be used to determine vulnerability. Median household income, cost-burdened renters, cost-burdened homeowners, and per capita income are the most crucial elements to calculating vulnerability for this project. Analysis of these variables will provide relevant insight into mitigating current and potential vulnerability-related challenges. And here is the vulnerability GIS model. It begins with the block group and then expands to 4 optimized hotspot analysis tools. Then from there, we created a per capita income hotspot, a cost burden owners hotspot, a cost burden renters hotspot, and a median household income hotspot. And from there, we took all of those elements and made them into rasters using the feature to raster tool. So now we have raster hotspot per capita income, raster hotspot cost burden owners, raster hotspot cost burden renters, raster hotspot median household income. And we took those 4 features, or new rasters, and added them all into the raster calculator to come up with vulnerability. We then reclassified vulnerability to come up with our final vulnerability map. This is the vulnerability map of the Twin Cities metro area. The map to the right combines per capita income, cost-burdened homeowners, cost-burdened renters, and median household income to determine vulnerability. The more vulnerable areas are colored in red. The moderately vulnerable areas are colored in yellow. The least vulnerable areas are colored in blue. Research question. Which specific areas of the Twin Cities 7-county metro area are relatively warmer, less accessible, and more vulnerable? So this basically means who is most susceptible to heat stroke. This is the final GIS model that will determine where the most isolated, the hottest, and poorest people are in the 7-county Twin City metro area. And this final GIS model is combining the previous urban heat island GIS model, the accessibility GIS model, and the vulnerability GIS model. So our study layers are the urban heat island, which combined lakes, biomass, and impervious areas, emergency services access, which is comprised of hospitals and fire departments, and finally vulnerability, which combine median household income, cost-burdened renters, cost-burdened homeowners, and per capita income. So this is the final map that depicts isolated hot and poor areas in the Twin Cities metro area. The map to the right combines the urban heat island, cost distance, or accessibility, and vulnerability layer to ultimately determine which areas of the Twin Cities metro area are isolated, hot, and poor. Areas in blue are less isolated, less hot, and less poor. Areas in yellow are moderately isolated, moderately hot, and moderately poor. Areas in red are highly isolated, highly hot, and highly poor. Conclusions we can draw from this final map. Various areas within the Twin Cities metro area display high isolation, warm temperatures, and extreme poverty. This project illustrated that the areas with the most vulnerable people are also prone to warmer temperatures. If vulnerability is linked to poverty, then vulnerable people are unable to afford the amenities deemed essential for living comfortably in areas experiencing the effects of the urban heat island. When vulnerable areas are also the areas within the urban heat island, and these areas also have limited accessibility to emergency services, conditions dramatically worsen. Vulnerable areas within the vicinity of the urban heat island and with limited accessibility to emergency services are in desperate need of assistance. The warmest, least accessible, most vulnerable areas in the Twin Cities metro area appear to be East Bloomington, Brooklyn Center, South Minneapolis, Richfield, and downtown St. Paul. Possible future research: tracking emergency response times, devise alternative emergency service routes to examine route efficiencies, attempt to reduce effects of the urban heat island effect and monitor results, mitigate vulnerability by determining primary indicators and remedying negative outcomes.